So the lower third, there's a lot of surgeries that encompass the lower third as well. The lips are part of the lower third, the chin, the neck, and the mandible, and we'll talk about all of that, but I wanted to address the lips. This is a patient, believe it or not, that we just did fat grafting to the lip, and so we put fat in the lip to make volume, evident, and so that is definitely a youthful type procedure, but it also feminizes the face too. There's other procedures you can do. Upper lip lift. What's an upper lip lift? And lift is where you take a wedge of skin on the top, under the nose, out, and that lifts the lip and gives a more puckered appearance, which is also more feminine. Also the chin and mandible. So this is a patient, guys, when you look at the top picture on the right, you're going to see what I call the chin neck deformity, where it's just all together and it just looks like a straight line. And so we like to distinguish the neck from the chin, and there's very surgical procedures we can do. There's procedures within the mouth, and there's procedures outside of the mouth you can do to adjust the chin. A chin implant's an easy procedure, and you can do it through the mouth, or you can go underneath in the neck area to put a chin implant in. Sometimes you don't have to put a chin implant in, you can just shave the bone. The other thing you can do is break the bone, which sounds more painful, and it is. And you take a saw, you break the bone, and you advance the chin, or push the chin back to let the projection of the chin adjust according to the face. So some patients have a very large jaw, and that can look very masculine. And so for those patients, they'll come in and say, "Doc, my jaw is too big. This bothers me. Can you give me a nice, pretty jaw?" So we do this part of the surgery where we reduce the jaw. And how do we do that? We go in and cut bone and move the actual bone back and put mini plates and screws. For patients who don't have a chin at all and want a little bit of a side profile, you can shave the bone and add an implant. There's a lot of other surgeries, guys, associated with the chin and mandible, and we get into oral and maxillofacial surgery and orthognathic surgery, where we can actually move the craniofacial skeleton and make cuts to move the midface forward, adjust bites where the occlusion is adjusted, and also move the mandible with osteotomies in the bone. Obviously, when you break bone, you have to fix the bone. And fixing the bone means plates and screws. And it usually means virtual reality surgery, where a patient comes in, we take a CAT scan of them, and three-dimensionally make movements with a computer to determine where we're gonna move the teeth in relation to the bone, and we'll have to make appropriate dentures and implants and splints to hold everything afterwards. And so those are large surgeries. You can bleed a lot. They're not surgeries we do at surgery centers. Patients stay, and typically the recovery for those surgeries is a month because of the fact that you can't eat. Next slide. Also about the lower third of the face is the neck, and so this is a patient here who had a neck lift, facelift, and fat grafting, and this is a trans female, and you can see the before and after. The neck lift adds youthfulness, and it brings more attention to the chin and jawline. We add liposuction also to make sure that the skin stays tight and adheres to the underlying structures. We sometimes need to add a tracheal shave if the Adam's apple is prominent. We're limited on the tracheal shave sometimes, guys, because if you shave too much of the trachea, you can get into the voice box and make the voice very raspy, which is bad. You don't want to change the voice unless someone is looking to do that. There is really conservative because we don't want to change the voice. Again, you can see a lot of the procedures are not necessarily feminizing, but they do make you very youthful, and in that regard makes you feel more confident. And I think in that regard also feminizes the facial anatomy. Next slide. And this is the final result on this patient who really barely can see the upper lip, who had really a lack of fat under her eyelids and had almost droopiness of the chin, and so is quite happy and now wants us to do her nose. So, which we'll talk about these surgeries because they can be very long. Next slide. So, this is a laundry list of things, but and I don't want to bore you, but these surgeries are long, and they may take multiple operations. Sometimes you have to stage it with limitations in the sense that you can lose a lot of blood. We try to keep all our patients overnight for at least 23 hours, but this is a tough surgery in the sense that if you look in general at your body and your senses, almost everything is up here, right? Your sight, your hearing, your taste, your smell, touch in a way, so it can really drastically alter you. And I think in that regard, people are not prepared for how much anxiety and depression it can cause initially, which it can be a lot because your recovery is massive. It usually takes 4 to 6 weeks, but we tell patients up to 3 months to a year you can have swelling from the surgery. Wound care is done daily. We see our patients weekly because we recognize that these patients really can go down quickly with such easy things as just difficulty breathing and having a panic attack, right? All senses can be affected, which can cause depression, anxiety, and more dysphoria. Weight loss is common. It's great. These are great surgeries, but you have that medicine-y feeling in your mouth. Your sensation's off. Your mouth has been altered. You have incisions inside your mouth. And that's not fun. If you guys have ever had a cavity, imagine the cavity times 10, right? You don't want to eat anything. So post-op antibiotics and pain medicine are key to follow these patients for infections. We don't allow these patients to exercise or have sexual activity. Why? The face is very vascular. We don't want them to bleed, and they can bleed quite easily. So we don't lie about our complications. Complications happen, and we tell people about them. Hematomas or bleeding, bruising is very common. Swelling is gangbusters. It doesn't matter if we put you on steroids. You're going to have pain. There can be asymmetries. It takes time for the swelling to come down. You can scar a keloid if you're pigmented, or even if you're not. Sometimes the fat doesn't live, guys. 50% of fat, it goes away. And so sometimes patients need touch-ups. The really bad things that can happen are implant infections, nerve paralysis, tissue can die, open wounds where it takes time for the wound to heal, uncontrolled bleeding. Revisional surgeries are needed because of the fact that a lot of patients may not get the result they want because fat dissipates or because of scarring. And so what the take-home message is it's a labor of love, right? And it takes a lot of time and patience to be able to change someone's face. And what you don't see, unfortunately, Instagram and social media are bad in this regard because what they don't see is all the stuff the patients have gone through to get from point A to B. And you just see a before and after, right? And it's not, it doesn't tell the whole picture. It doesn't tell, well, how old were they when they got that surgery? How long was that surgery? Did they have any complications at all? Would they do it again? So those are the kind of things that we have to sit down and talk to our patients about. It's easy to do well, it's actually not easy to do the surgery. I'm usually sweating bullets, but I've been blessed to be able to be craniofacial trained and do a lot of other facial surgeries for cancer, for kids who have cleft lip and palate issues. And so I advise you guys, if anyone wants to get facial femme surgery, go to a craniofacial or maxillofacial surgeon because the difference is dealing with the complications. And then the complications are more reconstructive and less cosmetic, and those are things where if a surgeon doesn't take insurance, it can be a disaster for patients. these are not easy surgeries. The other last take-home point before I stop talking is we're not trying to change the essence of a person.